Hello, everyone. I am Vic Jagger with Urban One, and welcome to our open enrollment town hall virtual event with Maryland Health Connection. And I am joined by Carmela Peterkin Wilson, and I got your name right, so I'm
Yes, you did.
and we are excited about open enrollment. Okay, first and foremost, marylandhealthconnection.gov. That's the first note that you need to take, marylandhealthconnection.gov. And of course, that is the state's health insurance marketplace. And we're going to get into all things open enrollment. If you have a question, Carmela will definitely answer it for you. And so it's time to get excited, Carmela. Open enrollment is here.
Yes, it is. We're ready for everyone.
Yes. Okay. So tell us about Maryland Health Connection and how everything works.
Maryland Health Connection is your marketplace with the state of Maryland. You can apply for private insurance as well as Medicaid if you qualify. Open
Yeah.
enrollment is on and ready for everyone.
Yes. And so when can people enroll? I'm sure people are like, okay, so when is it going to happen? When can I do it? Can I do it now?
Yes, open enrollment started on November 1st, 2025, and it ends on January 15th. However, if you want your insurance to start on January 1st, you must apply by December 31st, 2025.
That's right. Marylandhealthconnection.gov. Okay. Y'all keeping up with that? And so let's let the people know what is actually covered.
10 essential benefits are covered through Maryland Health Connection, the state official marketplace. You get your doctor visits, primary care, any specialists you need, any medications you would need, mental health, very important in this time. We offer mental health coverage under all the different insurance providers.
Yes. And you say different insurance providers, um, Kaiser United Healthcare, and different providers like that, right?
We have Kaiser, United Healthcare, WellPoint, and United Healthcare in the year 2026 coverage.
So no matter where you live in Maryland, you definitely have a choice from multiple companies.
Yes, you have four carriers that you can select from.
Yeah. Because some people might say, well, I live all the way out here. Is it going to be restricted? Can I only use one or two? So it's important to know that you have multiple companies that you can choose from as well.
There's choices. There's
Yes.
choices.
We love options.
Yes.
Okay. And so let's talk about the federal changes that are affecting health coverage.
Uh, in 2026, the law is changing, and you would receive less tax credit through the Affordable Care Act. However, the state of Maryland is also assisting consumers with some of that tax credit that they'll lose through the federal government. It sounds like a lot, but
Yeah.
you can call Maryland Health Connection. You can come to one of the local DSS sites and we can walk you through.
That's right. Marylandhealthconnection.gov. Like I'm going to keep saying it so that it just rolls off and people just remember all the information will be at marylandhealthconnection.gov. And of course, if you have any questions, we are here to help you out with that. And so, what should people do to stay covered?
If you had insurance in 2025, it's ending on December 31st. You sometimes the system would auto renew you. If you're not sure or you just want to make sure, please contact marylandhealthconnection.gov. You can come to one of the Prince George's County DSS offices, Department of Social Services, and someone can assist you with that.
Yeah. And, the kind of enrollment help that's available, again, you have options, but can you talk about the kind of help that's available?
You have on-site help through Department of Social Services. We are in Prince George's County. We have an office in Temple Hills. We have an office in Landover, and we also have an office in Bellcrest Road. There are navigators in all three of those offices, and we can assist you with selecting a plan. You can also contact marylandhealthconnection.gov, or you can go to the website and go to you can just get an estimate and see what is required and how much you will be paying.
That's right. And that's marylandhealthconnection.gov. And this is such an important time, especially when we talk about healthcare. You just tell the people, why it's so important, why Maryland Health Connection is so dedicated to making sure that Marylanders are covered with, health insurance.
Health insurance is very important. As you can remember with the pandemic, a lot of consumers, a lot of Marylanders got ill. If you don't have insurance and you go to the hospital, your bill will be very, very high. If you have insurance, you're guaranteed one visit, one annual physical each year without any copays. And if you have to follow up with your physician, your specialist, your therapist, those things are covered under Maryland Health Connection insurance coverage.
Now, are there any things that people need to know about how they qualify, or within their household, the family members that are within their household, of course, where they live, they have options, but what do they need to know beforehand?
If you want to apply for your family, you need everyone's information, their social security, any adults, anyone that's working, you need your income also. And household is whoever is in your taxes, not all the people that live in your household. Just whoever is on your taxes, that's considered an household. Eligibility is based on income and is also based on family size and as well as immigration status.
And of course, this is if you want to be covered for the new year, you have
Correct.
to enroll by December 31st.
Correct. Maryland, the insurance open enrollment ends January 15th.
Mhm.
However, if you come in January, your insurance will start in February. If you
Okay,
wanted to
so
start
yes,
in
that's
one,
that's important to know because
yeah,
we don't want y'all saying Carmela said that. Nope, she's letting you know right now. So let's make sure that we're clear on this. Make sure you enroll by December 31st if you want your coverage to start in January.
correct.
Okay. And if you apply for coverage after December 31st,
But before January 15th, your
you'll be
coverage will start in February.
right. And so the biggest thing here is to get it done now, to get it done as soon as you can, because we don't want any confusion and we don't want you to have to wait, if there are services that you need for yourself or your family members. So you can go to marylandhealthconnection.gov. Now, are there any things that people come to you for questions? And, if they did have questions about the enrollment, what are some of the things that people are asking or that they need to know about open enrollment?
One of the main questions that people have is how much help would I get to pay for my coverage? And that depends specifically in your household. So
Mm,
someone that lives by themselves is just one person on their taxes. The information that is provided will be different for a family of four, for instance.
mm,
Whatever you earn is just for you, and the coverage would be based on the monthly payments would be based on your income. If you have a family of four, things change. Two
yeah.
households, two family members are working, or maybe just a mother and three children. It's based on income, family size, age. All of those things are criterias. We put the information into the system, and the system will give us an answer.
And what if someone got married after they enrolled?
That's a special enrollment. So if you got
Okay.
married in February and your insurance started in January, you would just come in and say, "Hey, I have a spouse. This is the person's social. This is the person income," and we'll add them to the system. If in March you end up pregnant, you come in and say, "I have a special enrollment. I'm pregnant now. I'd like to change my information," and we'll update that as well.
So there are special
Circumstances, yes,
circumstances, yeah, excuse me, that people can come back and make sure that they have the coverage that they need for their families.
yes, it is. If God forbid you lose your employment and you had insurance with your employer, that's a special enrollment. You'll come in within 60 days of losing your income, and we can add you as a special enrollment as well.
Oh, see, and now see you have options. And this is the type of information that people will get if you go to marylandhealthconnection.gov and make sure that you are applying by the deadline. Are there any other things that people need to know before or after they start the process?
If you're trying to see if you qualify or if you're coming into an office, just make sure you have all your documents in front of you. That's the easiest way. Make sure you have everyone's social security number, everyone's immigration status, everyone's income, 1 month of income per person. Those things would make everything the process go faster.
And so starting in 2026, Marylanders who are not eligible for Medicaid due to their immigration status, um, can you talk about their, uh, the income that they would have to have and talk about whether they qualify for the tax credits and things like that through Maryland Health Connection?
Sure. In 2026, the law is changing.
Yeah.
As it stands right now, you might receive some credit from the federal government and a little bit more from the state of Maryland to help balance the payment. However, some households might not qualify for any tax credit. We are expecting that maybe in January things will change. I have been telling consumers they can try, if they, for whatever reason, they don't qualify for the tax credit that they're used to, they can come back in January and see if the law has changed. But for now, certain people would be able to purchase insurance without financial assistance, and some households will be able to purchase with financial assistance. And financial assistance is the tax credit.
And for those who are just curious and they want to compare the health plans, can they go online and do that as well?
Yes, there is a marylandhealthconnection.gov. You would go on the website and there is a purple bar that will come up saying you can browse for plans. It asks minor questions and it would give you an overview of the plans and how much they will cost based on the income information and the amount of people and their ages that you put on your search. Is an anonymous browsing. You don't have to put your names, just your zip code and everyone's age and if they're seeking insurance.
Yeah. And for those who, have additional questions, is it available? Can they also go through Maryland Health Connection and actually speak to someone, schedule an appointment if they needed to get a deeper dive into their situation? Because everybody's circumstances aren't the same. And sometimes when you go on websites, you're like, okay, well, that doesn't apply to me. But how can I get that assistance?
There are people working online through Maryland Health Connection over the phone. You can ask your questions that way. You cannot schedule an appointment, but once you're speaking to someone, they can help you with your application right then and there. Or you can start an application online if you get stuck for whatever reason or you're not sure. You can come into a DSS site and someone can help you in person.
Okay.
So there's options.
That is the theme. The theme today was there are options. You can call 1-855-642-8572 or go to marylandhealthconnection.gov. And, we are just encouraging everyone, if you have not signed up or if you're curious, sometimes people don't think that they qualify or they may feel like, I don't have, or I work full time or my benefits might get cut here and they don't understand that they probably could qualify. And so can you talk to those people who may be unsure and may not think that this is something that can assist them as well?
It doesn't cost anything to ask a question. Questions are free and answers are free.
Carmela is a straight shooter, y'all. Okay. Carmela, is there anything else that you would want to tell people who are watching when it comes to Maryland Health Connection, open enrollment, and really, taking priority, making sure their health is a priority, especially going into the new year?
Take care of yourself. Once a year, you get your physical. You wouldn't be able to get your physical if you don't call Maryland Health Connection to see if you qualify for health insurance. You could qualify for free insurance, which is Medicaid. And if you earn a little bit too much for Medicaid, you can always qualify for private insurance with financial assistance through the state of Maryland and the federal government. Deadlines, December 31st, 2025, for your coverage to start on 1/1/2025. If you miss the deadline, there's always January 15th. That's the very, very last day. And your coverage will start 2/2/2026.
So you have until January 15th, but we are encouraging you to go to marylandhealthconnection.gov right now, get the information, enroll, and if you have any questions, just make sure that you ask them. As Carmela said, it doesn't cost anything to ask a question. So
Yes,
thank you
ma'am.
so much. Yes. Were you about to say something, Carmela?
No, it does not it doesn't hurt, and you can get covered and go to your doctor's visits.
Yes, absolutely. And so Maryland Health Connection, their call center offers support in more than 200 languages. So you can call 1-855-642-8572, and they will definitely help guide you through all of the information so you can stay covered and find the right plan that meets your needs. So thank you so much, Carmela. MarylandHealthConnection.gov. And of course, I was going to give your personal information because, we need a direct connect with Maryland Health Connection, and you are that girl. So no, I thank you for the information. And once again, it's MarylandHealthConnection.gov. Carmela Peterkin Wilson, thank you so much for joining us today.
Thank you, Miss Vic. It was a pleasure. Thank you.
MarylandHealthConnection.gov. Thank y'all.
Take care.